I guess it has been a while since we recorded one of these.
Hello, healthcare consumers, and welcome to Gary and Jay's Healthcare Insider, the program that tries to help make healthcare easier to understand and navigate. We are committed to make healthcare personal. Today's program, Medical Debt, is the 7th and final edition. This episode will identify the top 6 medical debt solutions. I'm Gary.
I'm Jay.
And we will be hosting today's program. We are not clinical people. We are experienced in the business of healthcare with over 50 years of combined experience. We bring an insider's view of how healthcare works. Our goal is to share our knowledge with consumers. My career spans managing hospital and physician revenue cycle operations that include patient admissions, pre-certification, insurance verification, billing, and medical collections.
As CFO for both small and large health systems, I've gained many insights regarding the medical debt challenges and issues we've shared in previous episodes. Hopefully you've learned many important lessons and will have tools that you can use to deal with your own medical debt issues.
Here we go with today's program, identifying the top 6 medical solutions.
First, let's recap. What is medical debt? Medical debt is debt incurred by individuals due to healthcare costs and related expenses. Medical debt is different from other costs and related expenses because it's usually unplanned, accidental, or faultless. Medical debt can have negative impacts on households, such as reducing spending on other essential items or preventing individuals from seeking needed medical care or treatment. Medical debt can also lead to bankruptcy. Do you have a medical bill? If yes, medical debt can indeed be a significant financial burden for individuals and families. When someone incurs medical expenses that are not fully covered by insurance, or you do not have insurance, you may end up owing money to healthcare providers. This debt can accumulate due to various factors, such as high deductibles, co-payments, out-of-network charges, or uncovered services. Now it is time to discuss Gary and Jay's top 6 medical debt solutions. We have covered a number of solutions for the healthcare consumer to use to reduce their medical debt. Some solutions are easier to implement, while others require a deeper understanding of the solution process to implement. Since our team has an in-depth understanding of the solutions, we are going to develop a list of these solutions from the easiest to the more complex. This approach will help the healthcare consumer start the process while gaining understanding and confidence. We know this can be difficult and intimidating. Remember the following ground rules as you start. First and foremost, do not ignore the bill. Make sure you prepare as much information you can gather, copy of your bill, amount you owe, your account number, if possible, the provider's financial policies, and reason for your call. It is your money. Don't be afraid to ask for help. The healthcare provider can either say yes or no. If they say yes, you win. Most healthcare providers will engage and help you take advantage of them. Always be confident and honest. The top 6 tips. Episode 5, do I qualify for any healthcare discounts, either prompt pay or as an uninsured patient? Episode 4, how to negotiate a medical debt. Episode 5, how to document your conversation with a healthcare provider. Episode 3, how to use Medicaid and charity care programs. Episode 4, the No Surprise Act. Lastly, Future Help, episode 6, the medical... No, we aren't doing that. You have to start somewhere. Having a conversation with your healthcare provider starts the ball rolling. The following is a guide for you to follow.
The environment. Medical debt is soaring in the United States as healthcare costs continue to rise. A single trip to the hospital or any medical provider may cost you thousands of dollars, and insurance, if you have it, doesn't cover everything. When you are faced with overwhelming medical debt, it is important to know that there are resources available and steps you can take to manage your debt and relieve the stress of your financial difficulties. The following is a guide for you to follow. The following checklist will guide you through the medical debt negotiation process. Number one, negotiate with healthcare providers. And in more detail, you can refer back to episode number 4. Contact the healthcare provider's billing department to discuss your situation. Have your billing statement in front of you when you call. Ask if they offer any prompt pay discounts or financial assistance programs. Negotiate payment plans that fit your budget. If you have multiple bills with the same healthcare provider, ask if they can be consolidated, all the debt in one bill, so that you can make one payment each month rather than payments on each bill. Document the person you spoke to, the time and date, the final resolution, and request the outcome in writing. Apply for medical assistance programs. Some hospitals and healthcare providers offer financial assistance, charity programs, to low-income individuals or those facing financial hardships. Inquire about their policies and apply if eligible.
Be sure to explore government assistance. We covered this in episode 3. You'll have to investigate whether you qualify for Medicaid or other state or federal assistance programs. Some organizations have financial counselors to assist consumers with applying for these programs. These can help cover medical expenses if you meet the criteria. Set up a payment plan. Work with the healthcare provider to establish a payment plan that you can afford. Make consistent on-time payments to reduce the debt. Avoid collection agencies. Try to prevent your medical debt from going to a collection agency, as this may negatively impact your credit. Keep communications open with your healthcare provider about your situation.
What is charity care? And we covered this in episode 3. The Internal Revenue Service defines charity care, also known as financial assistance, as free or discounted health services provided to persons who meet the organization's eligibility criteria for financial assistance and are unable to pay all or portion of the services. Depending upon their eligibility criteria, hospitals may provide charity care to both uninsured or insured patients. Among other government regulations, federal law requires that nonprofit hospitals, which account for nearly 58% of the community hospitals, provide some level of charity as a condition of receiving tax-exempt status. And many state governments require all or a subset of hospitals to extend charity or eligibility for charity care to certain groups of patients. Within the broad parameters set by government regulations, hospitals establish their own charity policies, which may vary in terms of eligibility criteria, application process, and the levels of charity care provided. While hospitals bear the direct costs of providing charity care, support from doctors and federal, state, and local governments may cover some or all of those expenses. Estimates from one study suggest that the value of tax exemption alone cover about 50% of the charity cost. Other community benefits provide a nonprofit hospitals from 2011 to 2018.
The No Surprise Act that we covered in episode 4 protects people covered under group and individual health plans from receiving surprise medical bills when they receive most emergency services, non-emergency services from out-of-network providers at in-network facilities, services and non-emergency service from out-of-network providers at in-network facilities and services from out-of-network air ambulance service providers. It also establishes an independent dispute resolution process for payment disputes between plans and providers and provides new dispute resolution opportunities for uninsured and self-pay individuals when they receive a medical bill that is substantially greater than the good faith estimate they received from the provider. Starting in 2022, there are new protections that prevent surprise medical bills. If you have private health insurance, these new protections ban the most common types of surprise bills. If you're uninsured or you decide not to use your health insurance for a service, under these protections, you can often get a good faith estimate of the cost of your care up front before your visit. If you disagree with your bill, you may be able to dispute the charges. Here's what you need to know about your new rights.
What are healthcare discounts? And these are covered in episode 5. Prompt pay discounts. The prompt pay discount policy is available for emergency and other medically necessary healthcare services. Certain services not deemed medically necessary are priced at package discount rates with no additional discounts, and all payments associated with such services are expected prior to or at the time of service. Prompt pay discounts insured patients. A 10 to 25% prompt pay discount may be offered at the time of service based on the patient's out-of-pocket expense. 10 to 25% prompt pay discount is offered to patients' balances after insurance payment. Receipt of full payment is expected within 30 days of the first statement date. Prompt pay discounts uninsured patients. A patient who is uninsured and does not qualify for medical financial assistance or charity and does not have any governmental or third-party funding sources. Accounts will be eligible for about a 25 to 40% discount. A self-pay discount may be offered at the time of service. Receipt of payment in full is expected within 30 days from the first statement date. Under no circumstances will the discount be applied to the patient's account until after the payment has been paid and the remaining balance on the account is offered discount amount. Patients with an upfront deposit will have the discount applied to the total bill, hospital charges, at the time of discharge. Healthcare Consumer Navigator Center is your healthcare partner that offers healthcare consumers information to navigate the healthcare maze via our website. The program and takeaway information of the program will be available on our website, www.healthcareconsumernavigatorcenter.com. Remember, this is our 7th YouTube program in the series and our final. Our next program topic will be the Medical Debt Forgiveness Act of 2024. This act is in process and hasn't been passed by the House or Congress. We're going to do a recap of what the act covers so that you, the consumer, will have a baseline understanding when it goes into effect. This concludes our program, Medical Debt Solutions, and we hope the program explained medical debt and has answered some of your questions. Thank you.